So guys, they have asked about spontaneous bacterial peritonitis for 3 marks. So spontaneous bacterial peritonitis means what? There is inflammation of peritoneum. Also there's bacteria, and this is spontaneously from somewhere this bacteria has come. From where? From the intestine. Okay. So basically SBP not systolic blood pressure, spontaneous bacterial peritonitis. Okay. So if you look at this diagram here, which we found on the internet, you can see here there is ascites, right? This is due to the cirrhosis of liver. Right, the liver is affected here, and because of which there is ascites. Okay, and in this ascitic fluid, what do you have? Bacteria. From where did this bacteria come? From intestine. Okay, so guys, understand that this is why it is called a spontaneous bacterial peritonitis. Okay, so person drinks a lot of alcohol, has cirrhosis of liver, can have features of cirrhosis. That guy, if he's complaining of abdominal pain, and if you think that there is ascites, and you must guess spontaneous bacterial peritonitis, because this can be fatal. Okay, this guy can have fever because he has bacteria infection, right? He can have fever. If he's already, the liver cirrhosis, he can have hepatic encephalopathy. So you should look at all this, and as this is one of the important conditions they're asking in the exam, and you should be aware of it. You got it? So when you do a paracentesis and you think, okay, it is spontaneous bacterial peritonitis, then you do a paracentesis, you check the ascitic fluid. If the neutrophils are extremely high, then you will think that, okay, there is infection. And if you try to see which organism, it could be E. coli. You can even culture it and grow it in blood culture bottle and find out the bacteria, right? Now, this is an, what are they saying? It can lead to acute kidney injury and death. It can be fatal. What are they saying? It can become the spontaneous bacterial peritonitis can lead to acute kidney injury, and it can also be, it can increase mortality. Okay, that is why they are saying please pay attention to SBP, not just for exam. Okay, so how will you treat now? Before going to this, they are saying that if you if you see more than one organism, it can be that there is a perforation also. You have to think about that. Okay. Otherwise, if it is E. coli, then it has come from intestine. You can treat it. So the treatment should start immediately. The word immediately they are saying here, you should give broad spectrum antibiotics like cefotaxime, piperacillin, tazobactam. Okay, guys, this is the combination that comes in, right? Piperacillin, tazobactam, cefotaxime. Cefotaxime is what? It's a third generation cephalosporin. Let's look at it. It's parenteral. So here you see, you'll have to admit the patient and give cefotaxime, parenteral, third generation cephalosporin. Okay, this is the treatment for what? Spontaneous bacterial peritonitis. Excellent, excellent. Otherwise, what are they saying? Piperacillin. Where will you get that piperacillin? In penicillin group you're getting here. See, piperacillin, uridopenicillin, extended spectrum. See, they are always saying broad spectrum you should give. Okay, semi-synthetic penicillin. Okay, piperacillin with what? Tazobactam. Let us see if this comes as which form. So this is also what do you say? IV only. Okay, injection. Intravenous use only, it says. Okay, now if you go back to the classification, the tazobactam here comes here. It is a beta lactamase inhibitor. Okay, you got it right. Okay, recurrence may be reduced with prophylactic quinolones such as norfloxacin, ciprofloxacin. Okay, after the treatment, again, if you don't want it to occur, then ciprofloxacin, etc. Prophylactic antibiotics reduce the incidence, that only they are saying. Okay, and it will improve the survival. For prophylaxis, you can also give cotrimoxazole, according to the latest Davidson textbook, which was not there in the previous edition. Previous edition, they said norfloxacin, ciprofloxacin. Now they are also adding cotrimoxazole. Okay, fine. They are saying something like this: only 10 to 20% of patients survive for 5 years from the first appearance of ascites due to cirrhosis. Wow. Okay. See, they are saying just ascites 10 to 20% for 5 years. That means if you have bacterial ascites, spontaneous bacterial peritonitis, then what happens? Okay. So you understood, right? So this is a very important topic. No wonder they are asking this in the exam. Okay. You got it, right? See, the mortality at 1 year is 50% following the first episode of bacterial peritonitis. 50% of the people will die within 1 year of this bacterial peritonitis. Mortality at 1 year is 50% following the first episode of bacterial peritonitis. Wow. Okay. What are they saying about salt? Something about salt they have mentioned here. Salt intake. What is it about salt? Just read it and tell me. Precipitating cause for ascites can be excess salt intake. Okay. Reduce the salt. Okay. If you have ascites. And no alcohol, people. Bye-bye.